The prostate is a reproductive organ, and you have the ejaculatory ducts that run through it. The bladder sits on top of the prostate, and the urethra, which is the tube you pee through, goes through the middle of the prostate. Prostate cancer is an adenocarcinoma, which is a type of cancer, and this is more common as men age. There are really not too many lifestyle or modifiable factors for prostate cancer other than diets that are high in fat content. Age is definitely a factor. Every decade that you go up, there's a higher incidence of prostate cancer. The lifetime incidence of prostate cancer is around 20%, and there is a slightly higher incidence of prostate cancer in African American men. If you're having signs and symptoms of prostate cancer, that usually would be a sign that it's metastasized. Most prostate cancers are detected just with an abnormal blood test. Occasionally you will find an abnormality on the rectal exam where you're feeling the prostate, but if somebody's having voiding symptoms, lower back pain, those could be signs of a more aggressive or advanced disease. So for patients who are having pelvic pain, lower back pain, voiding symptoms, sometimes those can be signs of more locally aggressive or advanced disease. The indications to do a prostate biopsy are an elevated PSA, an abnormal prostate exam, as well as PSA velocity, which basically just means the rate of change of PSA over time. There are some other more specialized blood tests that they've done to test men for prostate cancer, such as the 4K score and PHI, although PSA remains the gold standard. So once a patient is diagnosed with prostate cancer, treatment is really based on the grade or the aggressiveness of the disease, as well as sometimes staging studies in which we get a CT or a bone scan. In general, there are three main options for the treatment of localized prostate cancer, which is active surveillance. So in a patient who has non-aggressive cancer and they have a low Gleason score, then we can monitor it with blood tests and serial biopsies. For men who have clinically significant prostate cancer, the main treatment options we're deciding between are surgical removal, which is primarily done with robotic technology now, as well as radiation, which there are multiple subtypes of radiation, such as seed implants, external beam radiation, and some patients will hear about proton therapy as well. So my best advice for prostate cancer is prevention. This is one of the few cancers we can screen for, and we can make a difference. The general recommendations for screening are at age 50, and most men will be screened once a year for prostate cancer. You should get screened early and annually.